And I'll stick around. There are a lot of hands up, please. But not in 2 hours. Well, we're trying to wind up, but I'm not going anywhere afterwards, so stick around. But in terms of letting the event conclude, so, this lady, we'll do 3 then. We'll do this lady, if you want to leave the room, this lady, and this lady. Go ahead.
I have a son with ADHD. He's a severe case of ADHD, hypertension, and with explosive temper that needs to be controlled with drugs.
I'm sorry, I didn't hear the name. This is
My son is ADHD.
your son. Okay, thank you.
He's a severe case of ADHD, and he needs drugs to control his outbursts.
I'm sorry, I just didn't hear the first part.
Okay. Most people think that's not a serious condition, but in his case it is because he's so explosive and destructive.
Sure,
He
understood.
needs medication.
Yeah.
Now, the doctor prescribed the medication. The insurer, WellCare, says he doesn't need it and won't cover it. How is this program going to stop these insurers from interfering with what the doctors prescribe to help these people and other people who need the drugs that are prescribed?
2 ways. First of all, they won't be able to deny that coverage as a pre-existing condition, nor walk away from it if later on, it turns up and you didn't list it at the beginning when you first signed up, you didn't think of it, and so when it actually turns into a serious problem, then they try to throw you out. So that would be part of it. The other thing is that the private insurers, when they come to the marketplace that Jack was talking about, will have to have their coverage meet certain levels. Standard plus, premium plus. There are different words that have been used about what the levels are, but they will all have to meet those levels. So you as a consumer will know going in what you have paid for. And you won't have the problem that so many Rhode Islanders do of taking a look at that policy and not being able to make heads or tail of it. One of the national newspapers, I think the New York Times, just today published a letter from Rhode Island, from the Rhode Island Health Commissioner, about simplifying the language to make it clear. So we can set those kinds of things so that you're not at sea with nobody can understand what the insurance companies say because they want the wiggle room to be able to duck and dodge. So you won't have a better idea. You'll be able to know going in whether the coverage is there or not. And if they are cheating on what they've said, then they put at risk their ability to market in that marketplace. And they don't want to do that because they don't want to be chucked out. So there's a new discipline on them. They have to tell you what they're going to cover you for, and they have to honor their promises in a way that they don't do.
Okay, so if they say they're not going to cover you for the prescription drug you need,
if you knew that going in, then obviously you'd buy a different policy. One that does cover it going in.
Another thing, see, he's on Social Security, disability.
Well, in that case, he stays on.
Yes, but they're the ones who are denying him the medication he needs.
Well, that sounds like a constituent service problem, so let's solve that.
Yeah. See, another thing is, I'm tired of everybody blaming the baby boomers for the problem. We have kids, our kids are going to have kids, and they're going to be paying into the system. So why is it going broke?
It's been underfunded for some time now, so it's up to $38 trillion.
Yeah, but still, what about our kids? Our kids are paying into it now. Our kids are working.
Nick, get the information so we can help with the covering. And you were next.
Just one moment. I just want to tell this lady, if you go on the web to the company that makes your son's medication, all of these medication people have help available for costs. So if you go on the web to the company that uses medication, they'll help you.
Go ahead, ma'am.
I have, they deny it.
I just wanted to say something about the notion of, constitutionality and the founding fathers. They weren't free marketeers. They were actually fighting free trade so that we could develop industry and manufacturing and become independent in the first place. So they actually set up what was called the American system, which was a credit system where we actually issued currency. The government controlled it, the uttering of money, not a Federal Reserve System, not a central banking system. So this is very important to understand right now, because our governments are bankrupt. They're saying, you know, we have to, well, people are worried that we have to ration everything right now. And governments are reducing the reimbursement rate for Medicaid and Medicare right now. You know, I think 7 states, right? So what we could do is actually put the system through bankruptcy, reverse the bailout. I mean, we don't have to bail out derivatives. These things don't have any physical value. You want to create money. You want to print money to rebuild those industries and manufacturing jobs. You know, build nuclear power plants with the machine tools in the auto industry, not little green cars or things like solar panels. We really need a physical economic recovery right now, and we need to take over the power that the Federal Reserve has in order to do that.
Got it, understood. Thank you very much.
Very good.
This gentleman had his hand up.
Answer the question, though. When I was going,
Gentleman behind you, all right. Yeah, me. Oh, that gentleman.